Hello everybody, it's Dr. K here, Dr. Katka, ready for our Medical Monday. Makeup, ready, go. Look at this. I'm holding the sun in the palm of my hand. How cool is that? So it's becoming more and more challenging to find a spot where we can see the sunset that actually has internet. But we're good to go. We're good to go. We're gonna wait for a few of you because I know some of you are specifically coming for, hi Mary, for the Medical Mondays, and some of you are coming to see the sunset. We're gonna get both. While we're waiting, I want to show you, I wore, which you can't see, oh yes you can, my special Yosemite, California t-shirt. It's Yosemite is one of my favorite national parks, right there with Teton and Grand Tetons and Yellowstone. But anyway, about that another time. Hi Bella, or Kelly rather. Okay you guys, so you can hear me, can't really see my face, but that's okay unless I hide the side. It's okay, not much to see. So you can hear me, you can enjoy the sunset, and we are going to talk about anything and everything that has to do with the face, starting with the eyes. I have plenty of notes and I left them all at home, so we'll just have to pull it from here. One thing I wanted to add to our last Medical Monday about skin, which I don't know if I stressed enough, is, and especially on the face, the skin is a little bit thinner, so anything and everything will absorb through anywhere on our skin, but especially on our face. The reason I said makeup right at the beginning, because especially for women, but for anybody, we apply so much more onto the face skin versus anywhere else skin. And the most important part is, remember, anything that is a chemical, which is everything that is not essential oil or naturally based from plants, is going to have a toxic effect, and it's going to absorb very easily through our skin. I just passed on my way up here a couple, and the lady had a mask on, which again, remember, outside you do not have to wear a mask at any given point, especially when in nature. But when they passed me and they were, 2, 3 feet, 4 feet, maybe more, I could smell their detergent. The smell of the detergent that they used smelled nice. And the unfortunate part about that, it is a chemical that absorbs onto their skin the whole time they're wearing the t-shirt. So let's remember, anything that goes on the face needs to be non-toxic, because there is a higher absorption rate through the thin skin. Especially, I know for women, we put a lot of things around our eyes. This needs to be the utmost priority, to use non-toxic clean stuff on our face. Okay ladies, and of course gentlemen as well. So that's number one when it comes to the skin. As far as anything and everything on our head, you would think, starting with the eyes and the ears, it has to do, when there's a trouble with our ears and with our eyes, we would think, let's go to the eye doctor and let's fix it there. Let's go and check the HENT and let's fix it there. But again, as everything else, including the skin, when the trouble is on the outside, the trouble 99.9% of the time is on the inside. So two things. Guess what? It's the liver again. We're back at the liver. The liver opens into the eyes in Chinese medicine. This is actually beautiful. Look at that. It's the eye right there. The kidneys open into the ears. I'll start with the ears. They're easier. Any buildup of wax usually has to do with the body's inability to process fats, and it's just dislodging it. And as any wisdom of the body, like we talked about through the skin, is similar through the ears, trying to get these substances out of the organism. Okay, so that will be there. So yes, we can take care of the wax, but we have to take care of the inner metabolism, specifically of the fat metabolism. We talked about that many times, but if you have questions, let me know. Big piece about the ears is ringing in the ears, tinnitus. I have seen it so many times. I have experienced it. My dad is struggling with it. A lot of my patients. We are, if you go online, there's hundreds of supplements that will help to treat tinnitus. Again, I don't know if you notice, if anybody of you has it, or any being that is struggling with tinnitus, my heart goes out to you because it's very uncomfortable. But you most probably notice that it's worse at some point and it's better at other. Big piece about tinnitus is the more toxicity, especially heavy metals, the body is dealing with, the more we'll have tinnitus. So big piece about that is supporting kidneys, and we'll talk about that. Let's talk about kidneys next Monday because that's a big organ that we really have to address. But supporting kidneys, and number 2, supporting the elimination pathways of the colon, meaning we have to have binders, toxin binders. We talked about that many times, especially during our Facebook Live. But remember something as simple as the activated charcoal. Activated charcoal on a daily basis, minimum of 4, best 6 at bedtime. And if there's a big struggle, double the dose. Go 6 in the morning, go 6 at night. It will really help to bind the toxins, and it will calm down the tinnitus, together with at least minimum of 2 liters of water, which is half a gallon, best 3, so 3/4 of a gallon. The other part on the kidneys is when we drink water, we gotta have electrolytes in the water. So put basic lemon, put some, really clean Himalayan salt, something that will really help to flush the kidneys and support our ears and the ringing in the ear. The other big piece that's very simple to do is the medical medium detox smoothie. Not only does it bring nutrients in, and here I'm talking about the ears and the kidneys, but everything I'm saying up until now benefits the eyes as well. So we're not just at the kidneys, we are at the eyes as well. We're building up to it. So I promise you the eyesight, it will be the icing on the cake. So with the medical medium smoothie, all we do is first thing in the morning or anytime during the day, you can look it up online. It is wild blueberries, high in antioxidant. It's a little bit of cilantro and dulce, which are the binders of heavy metals. Put a banana in there to make nice electrolytes and sweetness, and we're good to go. We can add, I usually add a lot of more things, but this is just as simple as we can make it. And the sun is going behind the mountain. This is almost, we're not there, but this is as, in Japan, there's a special moment when the sun rises and sets right on top of Mount Fuji. And I always try to recreate that here, where the sun would set right on top of the mountain or rise. So we're very close, almost caught it. I had to have the Wi-Fi in mind, so I was a little bit off, but gosh, that is my dream. Very soon it will happen where I'll witness the sunset and the sunrise, not only from top of Mount Fuji, that's one of my biggest dreams, but also see it like that. They call it the diamond. It's the most beautiful. Let's enjoy this for a minute as we are waiting to hear more about, there's so much on our head really that comes to mind that we can talk about. It's almost like 2 sessions right here. Good night, beautiful sun. Oh, so beautiful, you guys. Okay, I have some questions there. Can't really read them now that my eyes are blinded. Eyesight is blinded by the sun, so I have to go back to that. But so we talked about the skin, we talked about the ears, the sinuses. Let's talk briefly about the sinuses because that's easy and it's really pertinent for Arizona. Arizona is so high in, of course there's wind and dust, but what that means is there's a lot of spores in the wind and there's a lot of spores in the dust, and we breathe it all the time. And so you might have noticed friends or anybody moving to Arizona all of a sudden coming down with so many allergies and so many sinus problems and sinus infections, and a lot of them unfortunately get antibiotics for this, which is the last thing that's needed right now. Antibiotics are not indicated at all, quite the opposite. That could make matters worse, or just temporarily better and then chronically long-term worse, because they do kill the bacteria, but they make the fungus worse, which is most of the underlying sinus infection problem. Easy thing to treat that if you have access is IV hydrogen peroxide is the easiest. Just 3 of those in consecutive session usually does the trick. If you don't have access to that, you can do oral hydrogen peroxide. You have to be careful about that. There is a book called 1 Minute Cure. If you need any more information, reach out to me. But 1 Minute Cure, very simple. I had few patients that couldn't come in that started that, and they just swear by that, and it didn't take too long. The other thing is nice neti pots to go in. We could put a little bit of hydrogen peroxide in there. We gotta be careful there. We gotta stir very little, few drops, just to make sure. Put it on the nasal mucosa first. Make sure it doesn't burn. It has to be very gentle, just tiny dilution, and then we can go right in the sinuses. The other thing with the sinuses is diet makes a big difference, especially dairy. Anything that is mucous membrane, the dairy will actually make the mucus production higher. So slowing down or best eliminating dairy for sinuses, magical. And then there's quite a few different sprays that will be more individual. So if you have questions, let me know, but we can actually have a pharmacy prescribe a special spray with a few things in there. So if needed, we can do that as well. So that's the sinuses. And now, drum roll, the eyesight. How magical is the eyesight? Remember, we always try to remember, there we go. The best about what the body has to offer. And I feel for me in particular, eyesight is very precious. And when it comes to fear, I was just reading Napoleon Hill, and there are 7 basic fears for human beings. And the first one being the fear of poverty. The third one being fear of ill health. It's not until the very last one that the fear of death comes, which I was very surprised. But I know for me, being a doctor, it's been a little tricky, but it's the fear of ill health. And in particular, eyesight is there's something very special for people when and we'll talk about the lungs probably right after the kidneys, but when we cannot breathe, when we have chest pain, right? It has to do with the heart. And when we start losing eyesight, that's a big deal for us as humans, because those are, of course, breathing and heart are the vital organs that we need to have in perfect health to have a good life and healthy life. But the eyesight is huge. So for me in particular, eyesight is everything. Enjoying nature, enjoying the sunset. So a huge part comes, thank you for any vision that is available right now. And I know there are a lot of people that have lost their vision, or that have been born without vision, and it's just my tremendous compassion and just my heart goes out to them. And then seeing them come out on the other side with this incredible power and strength is just like, wow, So a big piece, number one, is just honoring and gratitude for our eyes. That really helps us with this world and this life. So how do we preserve our eyesight? Eyesight, just like everything else, but especially eyesight, it is so important to treat it as soon as we possibly can. And the idea here once again, remember, the liver opens into the eyes. What happened for me, and it didn't connect at all, when I was in medical school back in Europe, I started when I was 18, I was about 22. I had some we're gonna have to save the dental for another time because it's a whole session on its own. But I had a dental big deal happen there with the amalgam with the mercury, and I didn't connect the dots until much later in life when I had to have things redone. My eyesight started going bad very shortly after, and you know, it was like, oh, you're reading too much, you're studying too much. Of course, it's the natural course, you know, for getting eyesight bad and having to have glasses, right? Quite the opposite is true. It is not normal to have to get worse and worse when it comes to our eyesight. It is not the norm to have to wear glasses, and as we get older, you know, there's a lot of people that actually, the more they take care of their health, the better their eyesight is. It's quite remarkable, no matter the age. So the idea is everything else that we talked about with the internal cleansing, with the internal support, when the eyesight starts going bad, the big piece is to start working with our liver and start working with the heavy metals. Very important, very important. I can't stress that enough. It's to start pulling the heavy metals, like everything else I said, for the kidneys and the ears, and binding the toxins in the colon with at least the activated charcoal, and then anything and everything we can do after, which is the cleansing diet and all that. Number two, eye exercises are very powerful because we're bringing blood flow into the eyes, and there have been a lot of people that have healed their eyesight when it comes to really doing these exercises. Number three, I have these really great drops that are optique drops that are homeopathic that help. There's some other herbs. One of them is eye bright, really simple as that. Eye bright that's being taken orally, that really helps to brighten our eyes. And then if you have access, and if there's any severe condition going on, like macular degeneration, God forbid, for those we do have treatments, but the ones I know that work are intravenous, where the ozone and chelation come in. They are quite magical when it comes to the stopping the progression and actually creating relief. So I'll leave you with that. It's been a little longer today. Thank you so much for coming and staying and witnessing this. I'm going to read your notes and I'll reply to them later when I'm on my computer. But just remember, everything on here we heal internally, and then we do the topical. And for the eyesight, there is so much more, and one is, look at that beautiful cactus behind me. One to add is gratitude for everything that we're seeing in the world is a big one. And then the second one is healing the liver and everything else. So any questions, please let me know either on here or go to my website, drkatka.com, contact us, and feel free to email me and ask me anything. Thank you so much for visiting today, and we shall, what did we decide? Yeah, we'll work on the kidneys next Monday. That'll be a good continuation of our Medical Mondays. Many blessings, all the best to everybody. Take care. Bye.